So healthcare costs are increasing at too high of a rate. We need to bring down the cost. So the main objective of healthcare reform is to spend our healthcare dollars more wisely. We know, for example, if you get preventive care and stay healthy, they'll be less expensive. By the way, you also have a better quality of life. We know that. We know wellness works. There shouldn't be limits on how much an insurance company pays out. After all, that's why you have insurance, to deal with the catastrophic costs. There shouldn't be co-payments or deductibles for using preventive health care. There's a lot of disincentives initially not to take these tests. They're not always that comfortable. We shouldn't impose an additional burden by a co-payment or deductible. And health insurance reform eliminates those co-payments and deductibles for preventive health care services. This is why you should be concerned about it. Because there's a hidden tax in Maryland. Because people go to emergency rooms who don't have health insurance, many times in a worse state than they would be if they had seen their doctor at an earlier stage. They get the services and they don't pay their bills. It becomes uncompensated care. Hospitals charge a little bit more because of that, about 15% more. Doctors charge a little bit more. And you and I pay for it, those of us who have health insurance. It's been estimated that there's a hidden tax in Maryland of $1,100 a year for those who have health insurance, paying for those who don't have health insurance. So part of health insurance reform and health care reform is to have everyone take on their own responsibility. But the most important thing in health care reform is to get health care costs down so that we can continue to provide the type of budget support for Medicare in the future. Every year I've been in the United States Congress, I've seen attacks to reduce the Medicare budget because they're trying to get the federal budget balanced. Well, the way to bring down Medicare costs is to bring down health care costs. So we don't pick on our seniors. Health insurance reform, health care reform is critically important to our seniors. So these are reasons we need to deal with it. And I think we have an excellent chance this year to pass a bill that would bring down the growth rate of health care cost, that would provide access to affordable care for every American, and do it in a way that will not add to the federal budget deficit.